Now, Corruption Watch has discovered that in spite of the free maternal health care policy, which makes medical treatment free for pregnant women registered onto the National Health Insurance Scheme, pregnant women with NHIS membership actually pay for covered services at the 37 Military Hospital, Mamprobi Hospital and Mamobi General Hospital. Corruption Watch investigative journalist Francisca Angel spoke to a woman who, after losing her child, did not have access to the corps because she owed fees.
The policy we inherited was cynically described as cash and carry. That is, if you are not well, you go to hospital and don't have money. Even if you are lucky to get a doctor that would examine you and prescribe, it would be just a sheet of paper given to you, signed by him. Go and find the medicine. If you can't buy it, you go and die. The cash and carry. And we said no, that shouldn't be the thing for the people. So we really worked to introduce the National Health Insurance Scheme. Along the way, we also added the free maternity care.
Pregnant Nana, not her real name, is rushed to the maternity unit of the 37 Military Hospital in labor. She's a National Health Insurance Scheme NHIS subscriber, meaning she did not have to pay for anything under the free maternal health care policy.
The free maternal health care covers maternal health services from pregnancy to delivery and through to postnatals. So when a woman is pregnant, she's covered.
But what turned up was a total cash and carry affair, as she paid for covered services before being provided the needed health care upon arrival at the hospital.
So the health insurance doesn't cover drug
This is private health insurance. It covers when you go for consultation, but not to buy the plan.
It only covers consultation. Hey!
Ghana comes free.
Ghana comes free.
Nana and her husband, a farm worker, lacked the finances to pay for the bills, so every bill given to them was followed by phone calls to relatives and friends to beg for money. As if that is not enough, the grieving parents were then hit with another news of the body being detained till a 1,064 Ghana cedis 17 pesos being the cost of staying in the neonatal intensive care unit prior to the death is completely cleared before a death certificate and clearance would be issued for the release of the corpse.
Okay, so after paying it,
You bring the receipt. Bring the one and pick one.
okay,
They will give you the deserts.
okay.
The NICU bill was not the end of their trauma. While they grieved their loss, they were again confronted with where to find the financial help to settle the NICU and mortuary bills.
That is not right. That is not right. That is not right. So if somebody is admitted to a ward and something happens or the patient couldn't make it, the facility is supposed to submit a claim for the period that the patient was there, the medication that was given, the diagnosis that was given, and the facility should submit a claim and National Health Insurance will pay. There shouldn't be any reason where a body will be held that they have to come and pay before the body is released to the relative. It is not right.
Corruption Watch contacted the 37 Military Hospital for comments, but as at the time of filing this report, they had not granted an interview 6 weeks after submitting a request.
And that's the unfortunate story of Nana. It's part of that longer documentary called Pay or Die. It was put together by Corruption Watch's team, and you saw in there Mrs. Vivian Adokobla, who is the Deputy Chief Executive of the National Health Insurance Authority in charge of operations, saying that being made to pay for medical treatment if you're a pregnant woman in Ghana is not right. As long as you are on the National Health Insurance Scheme, you are not supposed to pay. She also went on to say that there is no reason why the body of the baby should have been withheld from Nana, and that's exactly what's happened with her. Of course, the story takes a retrospective look by deciding to look at the reasoning behind the free maternal health policy as was thought through by the former president, John Ejekumko, for speaking there at that interview with JoyNews. We will be airing that documentary later on this channel. We'll also be bringing you more excerpts, more highlights from it, and more reactions from authorities, as well as that reaction, of course, we are waiting to hear from the hospital authorities. It's not just the 37 military hospital. There's also the Mamprobi hospital and also the Mamobi hospital, which were investigated by the Corruption Watch team. We'll come back to this story a bit later in the bulletin. Corruption Watch investigator Francisca Angel discovered that some women are being made to pay, even though some pregnant women are being made to pay in some hospitals here in Accra, even though the free maternal health care policy ensures that they be treated for free. Francisca has joined us via phone. Francisca, what was the motivation behind this piece? Getting this piece?
Okay, so the motivation was about a case I was handling somewhere last year where a young lady was on admission at the hospital. She had a baby and then was having financial difficulties. She couldn't even buy the necessary things she needed at the hospital, not even the parts she needed immediately after having the baby. And so things were really bad. So I needed to step in and then get help for her to go through the process. And so I contacted a few friends who I know raise funds to help people. And I even contacted Joshua Sigo to help through Adum FM to be able to raise some funds to assist the lady. So as we were in the process of raising the funds, a friend of mine called that she's gotten somebody who is ready to fit the entire bill. And so she needed the contact of the girl to contact her so that they can go and reach out to her. I was there when she called me back and said the call didn't end well. When she called, she was told the lady had passed on. And so that was when it hit me, and then I was like, possibly I could have helped earlier. Maybe if I was able to get her the needed help earlier, it would have made a difference. And this kept haunting me, and at a point I decided that, no, let me pitch this up with my bosses and see if they would support for me to investigate this thing, because I know that once you have an NHIS card, you shouldn't go through some situations in the hospital. Having a baby shouldn't be this messy for anyone. No one should end up in such a situation. And so I pitched it up with my bosses, and they all had interest in it. They gave me the budget and everything, and then we hit the road and started this investigation.
Okay, now you looked at 3 hospitals, 37, Mamobi and Mamprobi. Why those hospitals in particular?
It's actually not 3. There are 6 hospitals. The 3 is just the part 1, so we'll be bringing the part 2 also.
Okay.
Yeah, so we picked the hospitals based on, once we had a case, which was our case study that we wanted to use to start the investigation. What we did next was to speak with women to find out where they have their babies and then find out how the situation is there. So after speaking with a number of women, we identified that the complaints of payment were prominent in some particular hospitals. So we decided to just randomly pick those hospitals that have been mentioned on a number of occasions by different women. And so that was how we arrived at picking those number of hospitals.
Does it then mean, Francisca, since you investigated this, that there are hospitals in Accra or anywhere in the country which are sticking to this free maternal health care policy, hospitals which are not charging women who come and are pregnant?
That one, I can't really tell. But one thing I can say is that if we randomly select 6 hospitals, and out of the 6 hospitals, no hospital was giving the free maternal health care, then I doubt if it will be present in any hospital. I doubt if any hospital is giving it for free.
Right. It looks like there's a general policy issue there. Could it be then that, it's because the NHIS is not paying or is not paying in time, or the hospital could be in financial constraints?
Interestingly, when we were done with the investigation and then I went for the official interview, NHIS says they've been paying their claims. The last claim they did was in September, and then they said the following week after that interview, they were making other claims as well. So according to them, they are paying up their claims. I wanted to verify the claim of NHIS when I went to interview the hospital. And the hospital directors actually confirmed it, that indeed, NHIS have been paying it. And the hospitals, most of the heads of these hospitals were not even complaining about they not having enough money from NHIS. They were rather denying that charges of that nature was happening in their hospital.
Okay.
They were all insisting that, free maternal health care is actually happening in this hospital.
Okay.
And yeah, some of them, that was what they were doing. And then a few of them were saying, no, it covers this, it hasn't covered this, and trying to give you the notion that they don't really understand exactly what the benefits are. But then when you speak to NHIS, they also told you that it is not possible for any hospital to claim ignorance because they give you every needed document to embark on this free maternal health care policy. And moreover, they've been having periodic meetings with the heads of the hospitals and updating them and giving them the needed education. So it wasn't possible for anyone to claim ignorance.
Right. Francisca, great work there. When is the second part airing, and what's next for you in terms of
Hopefully,
the story?
we'll be airing the part 2 next week, Monday.
Okay. What's next in terms of the story? Where do we go from here?
We are going to petition all the stakeholders of this particular policy. So we are going to petition the Ghana Health Service, the teaching hospitals. We are going to petition Ministry of Health. We need to petition even Parliament because in the course of this investigation, when I was doing the interviews, one hospital actually accused Parliament of endorsing their charges. And so we are going to petition Parliament as well.
Right. Thank you very much, Francisca Enchel, for joining us on this.